My name's Anne McIntyre. I'm actually an occupational therapist, but I'm a senior lecturer at Brunel University, and I'm part of the Seeing What They See project team. So one of the things that we did alongside the study that Emma talked about was that we wanted to find out from health and social care workers what their understanding and experience of working with people with dementia-related visual impairment was. So I'm talking about that, and then I'm going to talk briefly at the end about how we've developed an online CPD course with the Royal College of Occupational Therapists about this for their members, and that's quite new in the last few weeks, so I'll just talk about that. So within this research study, we wanted to recruit those health and social care workers that we felt came in regular contact with people with dementia and or those with visual impairment as part of their working day. So one of the things we wanted as well was that we decided that we were going to carry out focus groups primarily if we could, because this provided opportunity not only to access the participants' understanding of what of this, but also to provide an opportunity for people to debate, discuss, challenge, modify their own opinions through group interaction. So we carried out a number of focus groups, but did land up doing some interviews, both face-to-face and online. And this involved about 61 health and social care staff. So one of the things that you might see from this, and you'll have to, I apologise now, this is using word cloud, and I haven't quite worked out how you can space the words out without them all going all over the page. So we interviewed quite a few nursing home staff, social work staff, occupational therapists, and visual impairment rehabilitation officers, as well as optometrists and admiral nurses. So one of the things that we did was that we showed all of the participants some video clips, some of which you've already seen today, and about that related to people with dementia-related visual impairment problems. And we discussed these various topics. So we wanted to know from them their awareness of visual problems that their clients might experience with dementia. We wanted as well to ascertain what their familiarity and understanding of different kinds of dementia, but with particular focus, asking them whether they'd heard the term PCA before, Benson syndrome, Terry Pratchett syndrome, etc., etc. So just to see whether they had already worked with people with these kinds of problems. We wanted also, there's no point in reinventing the wheel, so we wanted to know what kinds of assessments and management for people with dementia-related visual problems that these health and social care workers were carrying out, and what resources they found helpful for them, what training and support that they had, but also what they might want. So what we found was that most participants described a general experience and understanding of dementia, and I think this is perhaps recurring from what we've heard before. What they also identified, and this was especially the social care workers, but they weren't always given the diagnosis of the clients when they were reviewed, when they were referred. And what they said was that was GPs, are not particularly interested in the type of dementia, but really more about what the impact and the effects of it are. All of them had received some form of dementia care training, but very few of them had personal experience of working with people with younger onset or rarer forms of dementia. And when we asked about what they felt were sort of the components of different kinds of dementia, they had a greater awareness of memory loss, but also they did talk about visual hallucinations in dementia. Visual problems they tended to identify were those associated with older age, that we've talked about before, glaucoma, cataracts, not wearing the right spectacles, not wearing spectacles, that kind of thing, macular degeneration, and some people talked about Charles-Bonnet syndrome. Participants did also talk about how people didn't recognise themselves in mirrors, didn't recognise family members, had problems walking on patterned carpets or with contrasting colour flooring, as well as things like where solid walls disappear into glass walls or mirrored walls. These were things that they acknowledged, but they did feel that these were not, they were due more to memory problems or behavioural problems. One of the things that came up was after showing people the video clips, and that these were people with Lewy body syndrome as well as those with posterior cortical atrophy, it encouraged the majority of participants to think differently about problems for people within the clips and also for their own clients that they saw. So after seeing the clips, one person observed about the Brighton Pier clip, for example, was this idea of, I think it's like seeing as if they're seeing snippets of the picture and they were just able to see little bits and then putting the picture together like a jigsaw puzzle. And this, I mean, you used those words earlier, Seb, so, this is not an uncommon thing. And other people said that, about their people, that people they were seeing with hallucinations. I come across a lot of people with hallucinations, and now I'm sort of wondering whether they're seeing a shape, a light, something, and the brain translates it into something that's tangible, like a person. So rethinking their whole concept of what visual hallucinations in dementia were. Some of the health and social care workers did actually have experience in working with people with young onset dementia and PCA. And what one person said was that, when we have people with PCA, they initially present with bad eyesight, but sometimes it's things like not being able to fit a key into lock because they're trying to fit it in sideways. And this is what this OT made them think this person has got PCA or problems like PCA that needed further investigation. One of the things that some of the visual impairment rehabilitation officers identified was actually that there's a big difficulty getting the ophthalmologist to accept that so the person can get a certificate for their vision. So I know that has been brought up, and I know that might be a slight hot potato, but anyway. The interventions that people provided were quite pragmatic. There was a focus on function. What they said is that they mainly worked with the immediate problems that people presented with. And I suppose if you're not having a diagnosis of a client, then that's the best way to work. And with some of the professions, that is the philosophical way to go. And they said that that's why a diagnosis isn't always crucial. However, they did accept that if you're trying to work with someone looking at longer-term planning around employment, around housing, environment and major adaptations, this is really when you do need a definitive diagnosis. It seemed that people had an intuitive approach, and this intuitive approach was okay, I think, when people were open to new problems and new ways and use their clinical reasoning skills. Where it seemed to be more of a problem is where people tried to, their intuition was to try and fit new experiences to what they already knew about, so attributing problems still to memory loss or behavioural problems rather than things about visual processing. Other things were very pragmatic, this idea of colour contrast, and I think this is where they were on more familiar ground, using work that's already been published. And so they talked about how it's good to remove contrast within flooring and furniture, and patterns in carpets and curtains, but also using contrast when you're looking at the controls on a microwave, for example, or doors. Emma's already shown you pictures of what people have used. Things like colour contrast with plates is something that's debated. And at one point there was a real vogue for the colour red, but I think it's more what's the best contrast that works for the individual person. People talked about lighting and the need to reduce glare and reflection. But also, one visual impairment rehabilitation officer said, and I think it fits with Emma's picture she showed you earlier, I've got someone who would be happy if I was to install so much lighting in the house that you could land a plane in it. So that was quite funny and quite pertinent, I think. One of the OTs that worked with people with PCA talked about decluttering, and again, this has come up earlier. And their observation was about furniture. They may not be in your path, but your brain's seeing them. So your brain's saying, oh, there's 5 chairs in this room, and you're thinking, blimey, 5 chairs. But if there are only 2 chairs, there's one of them that's in your way, then it's easier because you don't feel so intimidated by all the chairs in the room. So decluttering both objects and furniture was something that they advised. Educating families was one thing, and I think supporting families. And teaching strategies like with food on a plate, using the clock mechanism, that kind of thing were things that people talked about. So as a conclusion of the research study was that we established that the health and social care workers in our study received generalised training about dementia and are less aware of more uncommon forms in younger onset dementia. And the features of dementia that they were more familiar with were things like memory loss and hallucinations. And visual impairments were not considered necessarily as part of dementia. And problems with everyday functioning were attributed more often to memory loss and poor concentration. And problems with vision were attributed more to ageing with sight, so things like cataracts and glaucoma. But I think they don't always know the type of dementia that their clients have and how this affects them. And they have limited access when they are referred to someone with young onset dementia. This is perhaps more for social care workers, is that knowing where to access information about those rarer and younger onset forms of dementia. And the other thing was that they felt was that there was a real thirst for evidence-based research to help them with their practice. When we asked them where they went to for information, number 1 was Google. And number 2, when it was around diagnosis, was the Alzheimer's Society. And this was another study that we looked at to see where people could get information around PCA, and Google seemed to be the most accessible. So that was from the study. So one of the things we then ascertained was that there was this lack of awareness, and some of our participants had real difficulty accepting new knowledge and relied on familiar knowledge to determine their decision-making and interventions. So both the participants and within the team, it really highlighted and confirmed the need for further training, because just getting an idea for people to be much more aware of specific diagnosis, having more training around different types of dementia, and this need to wanting access to evidence from research, and this tangible support and evidence-based support for them to make the right decision. So out of that was born an online CPD course with the Royal College of Occupational Therapists. And this was timely, actually. We approached the Royal College of Occupational Therapists, who themselves were wanting to provide more evidence-based learning resources for their 32,000 members. So this is an online training. It's free to all occupational therapists who are members of the Royal College of Occupational Therapists. This was launched by them in May 2018 in Dementia Awareness Week, but has been based upon the research findings and the activity of the whole Seeing What They See team. So this is what it is. It's the online course has two resources. It has a workbook, which is based on publications and YouTube clips from the team. There's an individual pre-session work that each individual person does before they have a group session, and after that there's a section within the workbook for people to do post-session facilitation and identify key learning points that they've gained and that they need to go on further. And there are also PowerPoint slides for whoever the nominated OT is that's going to facilitate the session. One of the things that the Royal College of Occupational Therapists is encouraging is for members to send back their individual learning points to them so they can return a CPD certificate to them. And we will be able to access how many members of the Royal College will be doing that. And if anybody wants to have a look at that, I have a paper copy of both of those with me, and just like to thank you very much.
Hi there, my name is Jill Jones. I had a question for Anne. The online CPD that you were explaining about sounds really, really interesting. I'm actually a rehab worker, and I was just wondering whether there was any scope for it to be made available to the Rehab Workers Professional Network so that members of that organisation might be able to access it, because I think it'd be a really useful tool for a lot of us.
I mean, that's an interesting one. We did this in conjunction with the Royal College of Occupational Therapists, so it is for their members, but it's downloadable by their members. So I'm not saying this officially, but I'm sure that occupational therapists are very sharing people, and they will share those resources with their other colleagues.
Thank you. And if I could just add a really quick, cheeky one from a previous question and answer. We're talking about the PCA and difficulties with people being registered or if their eyes are sort of technically healthy. I was just wondering, we get a lot of people who are registered as sight impaired or severely sight impaired because of stroke-related illnesses. It doesn't seem a far stretch, if that's technically a healthy eye, why that people with PCA couldn't have that same afforded to them.
Very good point, thank you, yeah. And another question.
Hi, my name is Vary McClintock. I have PCA. I just wanted to check something that Anne had said. Did I hear that in your talk that you said that that often care people didn't know what the dementia was?
No, they understood dementia, but it was in more general terms, and in the same way that was raised earlier about
as a PCA, okay.
yeah, rather than rarer and no.
Yeah. I was thinking that can't be right.
No.
And
no,
so
no.
I was asking that just for reassurance, to be honest.
Yeah, I know.
Yeah, fair enough.
Yeah.
Okay, one more. So just.
I just wanted to ask the one question. I was very pleased with obviously all of the CPD and things that are going on. I was very disappointed, however, to see under the low visual aids that there's nothing to support people with PCA. So my question is sort of who sees it as their responsibility to develop this? Because obviously for the opticians there isn't an eye problem. For the RNIB, these people aren't blind. For the medicine people, they sort of lump it under dementia. So who is developing sort of aids that once you've actually have diagnosed that somebody has PCA, aids to actually help them?
That's a good question. I'm not sure. Yeah, that's a very wide question, because I think we've seen from the PCA discussions we've had before that there's not necessarily an aid that would help. I mean, the afternoon's discussions, what Keir's work has been working on and various other things, I think will probably answer your question later on as we go through, but I don't think there's a specific aid that would aid PCA.
sorry, all the aids are to make things bigger.
Yeah.
So they're all big print, they're all magnifiers. Actually, some of the times they need something the opposite.
Yeah. Yeah, so I'd like to say, I think I will refer you to Keir's work this afternoon if I can.